Autoimmune metaplastic atrophic gastritis. Atrophic gastritis is a form of chronic gastritis that is characterized by inflammation, mucosal thinning, loss of specialized cells in the gastric glands, and changes in the epithelial cell types, like metaplasia. The prevalence of autoimmune metaplastic atrophic gastritis, or AMAG, is relatively low, possibly due at least in part to underdiagnosis. Prevalence is 2 to 5%, increases with age, and is higher in females compared to males. It is associated with autoimmune diseases. In contrast, the prevalence of environmental metaplastic atrophic gastritis, EMAG, strongly correlates with the level of endemic H. pylori infections. Case report. A 65-year-old female presents to her primary care physician for evaluation for abdominal pain, bloating, and constipation. Patient was seen in 2021 for similar complaints. She reports intermittent abdominal pain not improved by defecation. CT abdomen pelvis on October 17, 2021 was non-diagnostic, and labs have been non-contributory. She endorses mild relief of abdominal bloating with chamomile tea and sodium bicarbonate. Her pertinent medical history includes Sjogren's syndrome, Hashimoto's thyroiditis, and autoimmune hemolytic anemia. She had an EGD in 2017, which showed normal mucosa with multiple polyps. Labs were remarkable for iron deficiency anemia, and then the decision was made to perform an EGD based on her age, that she was greater than 60 years old, severity, and risk of cancer. EGD showed erythematous mucosa with gastric mucosal atrophy. Pathology resulted with foci of acute inflammation, diffuse chronic inflammation, interstitial metaplasia, and severe paucity of the oxyntic glands. H. pylori testing was negative. So this is important because this case illustrates the potential for a patient with autoimmune diseases to have future implications that can predispose patients to malignancies. While she does not have gastric cancer, she will need close monitoring with frequent EGDs and biopsies. Furthermore, it is important to monitor and treat the complications of AMAG, such as iron deficiency, pernicious anemia, and vitamin B12 deficiencies. In conclusion, in those patients presenting with nonspecific abdominal complaints and/or unexplained iron deficiency anemia in the setting of autoimmune disease, and especially autoimmune thyroid disease, clinicians should have a high index of suspicion for AMAG and be aware of this little-known association to prevent delays in diagnosis.